Time is super important when it comes to stroke because the faster we're able to treat someone, the more likely they are to recover.
There's just a broad range of symptoms a person can have when they're experiencing a stroke. Be fast is a good way to remember most of those symptoms.
We teach this to children, we teach this to families, we teach this to teachers and educators and non-healthcare professionals for what to watch for. B is for balance, a sudden onset of difficulty with balance. So that could be an inability to walk, or it could be vertigo or dizziness, it could be nausea, but it's a sudden onset of problems with balance.
The E part is for eyes, so any sudden vision changes. So if you have double vision, or if you have a sudden loss of part of your vision, even just something as random as, like, say you're looking at the TV and you can't see that top, like, right-hand corner of the TV. That could be a symptom of a stroke, and it's always best to get it checked out.
F is for face, so what we were looking for in our face is to see if their face is uneven. Looking for facial drooping, it'll mostly be one side of the face. What you want to do is ask the person to smile to see if they're able to move that side of the face.
A for arm, so if you're having a stroke, there's a possibility that one of your arms might suddenly have some weakness. So if you notice that one of your arms isn't working like it typically does, that could be a sign that you're having a stroke.
S is the portion of speech. So we always tell people slurred speech is probably the most commonly known symptom. However, it's also people aren't saying words at all. So they try to speak and words just don't come out. Or if they're being spoken to, they don't understand what's being said. That's what we call receptive aphasia, so their brain hears it, but it can't process what's being said.
T is for time. Time is of the essence. We need to know what time your symptoms started. We need you to recognize that you're having the symptoms. Don't lay down, take a nap, thinking it'll feel better. After you take a nap, you get better. No, time is of the essence. It's our greatest adversary, because as soon as your stroke starts, your cells in your brain are changing, they're dying, and we need you to come to the hospital. Time is brain.